Hello everyone, and welcome to our Assessment Comparison Analysis presentation. In this presentation, we will be discussing a summary of a hypothetical client named Devin, as well as a description of two assessments, which are the Verbal Behavior Milestones Assessment Placement Program, or the VB-MAP, and the Assessment of Basic Language and Learning Skills Revised, or ABLS-R. We will then discuss which assessment is better to use for Devin, along with a brief discussion, and what the next steps should be after he is assessed.
Devin is a 5-year-old child diagnosed with ASD. Devin's current diagnosis is categorized as Level 2, requiring substantial support. Devin is proficient with receptive identification, matching, compliance with simple demands, 1- to 2-word mands, and 1-word tags. Devin does not attend to others and has difficulty discriminating between different WH questions. Devin's preferred reinforcers include kinetic sand and toy cars. They do not play with either functionally. Devin's maladaptive behaviors include tantrums and physical aggression towards their younger brother.
For assessment descriptions, we found that the VB-MAP was for ages 0 to 48 months. They focused on language and social skills. The limitations were it only measured up to 48 months, limited academic skills, and administrators required training and a familiarity with basic behavior analysis. This is a direct measurement, and data is collected when child is present. You need a copy of the VB-MAP protocol and experience proctoring the assessment. This assessment is selected for delays in primary language and social skills. For the ABLS-R, we found that the ages are 0 to 12 years old. They focus on language, social interaction, self-help, academics, and motor skills. An annual reassessment is recommended. The limitations we found were it does not address maladaptive behaviors, peer relations, and self-help skills that are critical to educational programs. This is also a direct measurement, and data is collected when the child is present. You need a copy of the ABLS-R protocol and experience proctoring the assessment. And this assessment is selected for delays in language, social skills, and academic-related skills.
We have determined that the VB-MAP is most appropriate to use for Devin due to their age, skill level, maladaptive behaviors, poor attending skills, and delays in language. The VB-MAP focuses on primary language delays and social skills, two areas that Devin does need assistance with. Another reason the VB-MAP would be most appropriate is it assesses social play, group and classroom skills, and early academics. All three of these need to be considered, with Devin being 4 and possibly starting school soon. Lastly, due to the popularity of this assessment, there are more experienced assessors to conduct the VB-MAP.
With regard to the testing timeline of the VB-MAP, formal testing and observation will be conducted in a clinical setting with no time limits. The total administration time of this assessment will depend on Devin's general level, cooperation, and assembly of materials by the assessor. The VB-MAP Milestones Assessment will provide a representative baseline sample of Devin's existing verbal and related skills compared to their typically developing peers. Once the assessment determines the specific skills that are present or absent in Devin's language and related repertoires, Devin's board-certified behavior analyst, or BCBA, will create goals and objectives to target and teach specific skills to him. When Devin meets specific milestones, it will not necessarily be assumed that training on that skill is finished. Rather, that skill should be moved on to a more advanced skill.